You are listening to the Spiritual Warrior Coach with Barbara Savin, the podcast for discovering how powerful your wisdom, compassion, and courage is. Get ready to join Barbara and her guests as they explore and offer you advice on how to reclaim your power, your energy, and your authentic self. And now, here's the host of the show, Barbara Savin.
Thank you for joining me today, and welcome to the Spiritual Warrior Coach podcast. I am your host, Barbara Savin, and I am here to help you reclaim your power, your energy, and your authentic self. I am a certified clinical medical hypnotherapist. I'm a Reiki master and teacher, energy healing specialist, a life coach, and best-selling author of Gentle Energy Touch, the beginner's guide to hands-on healing. You know, I have been helping my clients for over 35 years. And the older I get, the more wisdom seems to come through. So isn't it time that you believe in yourself? You know, your mind is going to provide you with your greatest challenges in life because it's so very, very powerful. So let's use it for positive thinking, creating harmony, balance, peace, love, happiness, and anything else that your heart desires. Because one day the world will tap you on your shoulder and say, this is your time to shine. And speaking about shining, I'm going to bring on my guest right now. Hi, Suzie. How are you?
I'm good, Barbara. I love that introduction. I
Oh.
love that introduction because that's my theme for this year with my clients.
Really?
Positivity,
Yes.
right? It's all about if you think you can, you can. If you think you can't, you can't. So I'm all about thinking positively, and we're all about manifesting strength and the discipline to do what we need to do to get the results we want to see. So I loved that introduction.
Well, thank you. Well, before we start with our interview, let me tell my listeners a little bit about you.
Okay.
Suzie Foreman, she is a physical therapist with over 35 years of experience working in orthopedics and sports medicine. And she is best known for dealing with clients with hip and knee osteoarthritis and has helped hundreds of patients decrease their pain and their need for medication while improving their strength and function. And along with her husband, Suzie guides her clients in the Joint Pain Relief Program, and we're going to get to that, a 2-month online physical therapy and training, personal training program. And when Suzie's not working, she's out hiking and cycling. So welcome. How are you today?
Thank you. I'm good, thanks. It's freezing cold where I am, but
where are you?
Toronto.
Oh, yes, it is.
Yes. And it's -7, feels like -17.
Oh, well, I'm in California. It's supposed to be 76 today and sunny. So I hate to say that, but
Jealous.
I know, right?
Right.
So I guess I need to ask you first. I mean, what actually made you decide to become, a physical therapist?
Well, I've always been active my whole life. I grew up in the tropics, actually. I grew up in Jamaica and was a wild animal running around outside all the time, climbing trees. I did ballet, gymnastics, tennis. And in university, a friend in first year told me about physical therapy. And I actually applied to both physical therapy and pharmacy, and then chose physical therapy over pharmacy because of sports medicine. And because I, at that time, taught fitness classes, like I said, I played tennis, I did gymnastics, grew up doing ballet, swimming. So it really appealed to me, the sports medicine side, the active side, and physical therapy. So that's how I got into it. And I'm been in it 35 years now. So I was quite young when I went to school. I went to school at 17.
Wow.
And I was 21 when I finished.
Wow, boy, it's pretty good. Wow. So you must love doing what you do.
I do.
You help a lot of people.
I do. I have to say, I do. Physical therapy is a phenomenal profession, and there are many different areas that physical therapists can work in. Although as much as I love my profession, there is a very, very narrow segment that I truly love, right? And that is where I am now in orthopedics and sports, generally acute orthopedics and sports. And that is really the area of physiotherapy that I love.
That you love. Now, let
Yes.
me ask you, you know, because there's all different type of osteoarthritis, osteopenia. I mean, so what exactly is osteoarthritis?
Okay, so osteoarthritis is, they used to call it a wear and tear, okay, of the joint. They're getting away from calling it wear and tear of the joint, because what was happening was some clients were fearful, and so then they wouldn't do any activity. And there's a happy medium. If you do nothing, you also degenerate, right? So they're now starting to call it joint failure. So osteoarthritis is a mechanical failure. So similar to, you've got brakes in your car and you use them every day, and you know they have the potential to fail, right? If you're not doing things to keep them as functioning as well as they should, right? So same thing with our joints. So it's, if we use the old terms, wearing down, and if we're using the new terms, they're calling it joint failure these days. So it's very different from, you mentioned osteopenia. Osteopenia is more the thinning of the bones. So different from osteoarthritis, which is the wearing down of the cartilage, the surface of the bones. And also osteoarthritis is very different from rheumatoid arthritis. Okay, so rheumatoid arthritis is actually an autoimmune disease. And yes, there's wearing down of the cartilage and other issues in the joint, but rheumatoid arthritis can also affect organs and the whole body systemically, whereas osteoarthritis really is mechanical and limited to the joints.
Oh, wow. So, you know, it's because I had a hip replacement about 3.5 years ago. And because, of course, it was wear and tear, but it was bone on bone.
Right.
So, and it was extremely painful, to be quite honest. It was hard to do anything.
Yeah.
You know, until I finally had the hip replacement.
Well, see, ideally, this is had we caught you like 10, 15 years ago, but this program didn't exist 10, 15 years ago. But had we caught you 10, 15 years ago, then ideally we might have been able to strengthen you up, get you on the right road, so you wouldn't have had to have that joint replacement. And that's the whole purpose of this program. And this is the first program in my 35 years that is meant for people as a preventative measure to catch them early, get them on the right road so that they don't end up needing either hip or knee replacement surgery, depending on what's giving them trouble. Whereas prior to this, we only had post-surgery exercise classes.
Right.
Yeah, so this is a big deal.
Wow. So like, if someone, let's talk about your program first, and then we can talk about some other things. So if someone was to join your program, so I guess what type of results can they actually expect, and how long does it take to actually see results?
Okay, actually, you know what? It's funny that you asked me that, because just before we went on, I thought, you know, I should just write down some stats.
Oh, here we
right?
go.
Because there are actually stats that are kept. This program was started in Denmark, okay? And it was developed by a physical therapist there doing her research with people with hip and knee osteoarthritis. And they developed a community program, and they kept statistics because it drives medical policy. And then because it did so well in Denmark, it got exported to different countries. So in the last year, what they've seen is for the majority of people, a mean 15 to 29% improvement in pain. So that's a lessening of pain. So I'm quoting you the stats now, actually from the research.
Right.
Over 30% of individuals experienced a marked improvement in their activities of daily living and sports and recreation. And over 45% of people experienced a marked improvement in the quality of their lives. Now, that's the statistics, okay, from the program. I'm going to tell you, I've been doing it for the last 1.5 years, and I'm going to be telling you some of the results that my clients have gotten. So I have clients who've gotten a significant reduction in their pain. And when I say significant, I'm thinking of one patient who had a constant ache in her knee for years, just a dull ache, 2 out of 10. And by week 4, week 5, actually, I say week 5, because at week 4, she was kind of going, oh, I don't know. But by week 5, she said, all of a sudden, it disappeared. Another client who had knee pain, again, usually around the 4 or 5 week mark, his night pain disappeared. And again, someone with swelling, same kind of thing. I have someone who finished the program. She's a nurse and she hikes. And she used to, at the end of an hour hike, have like 7, 8 out of 10 pain. Now she barely gets a 2 out of 10 pain on that same hike. So they're seeing less need for medication. They're seeing less pain, much more function, and much more strength. The program is 2 months. Okay. By the time they have clients do an initial assessment with me so I can get a baseline. Then they do a session with my husband, Andre, where they do a private session. So they go through the exercises and learn how to set up their program, learn how to set up their house. And then they come into the class sessions. And the clients who do see the results are the clients who are consistent. The trick, the clue, show up. Show up for your classes, do it under our guidance, and I almost 100% guarantee that you are going to get results, right?
Wow. Boy,
yeah, and usually around the 4 or 5 week mark is when patients are starting to say they're stronger, taking less medication, they're sleeping better at night. We see it consistently.
Is this just for hip and knee?
Right now, there is a pilot project with the back, but I don't have access to that back program yet. There may be back. I would love to see a shoulder. And believe it or not, I have a lot of specialty in the jaw. And that is very underserviced. But right now, it's for clients with hip and knee osteoarthritis.
So the program that you're teaching, is it just in person or can they?
No, we do it via Zoom. It was in person. It was in person prior to the pandemic. But once the pandemic hit, everything went online. And a lot of clients are really enjoying it online. They're enjoying the convenience, especially like today, -7, feeling like -17. They don't have to go outside, right? So our program is 100% virtual and everything is done online.
Wow. Boy, I wish I knew you a few years ago.
Yes.
Because boy, it hurt. It's painful.
Yeah, it can be very painful. I have quite a few clients and quite a few clients who are active, like really active. They want to hike, they want to ski, they want to play golf and tennis. And they sometimes if they overdo it a little bit too much, like before I met them, some of them were not, they didn't know how to do things themselves. And so they'd flare themselves up. And I mean, I remember one patient before she started, she was like crying for days because she had gotten a cortisone shot. The doctor said, yeah, you can play golf. And then she went and overdid it with 3 games of golf for the week and then an hour of cycling.
Yeah.
All right. So sometimes I think I'm not treating injury, I'm treating personality.
Well, yeah.
Right.
We do overdo it sometimes. I'm guilty of that one too. So
yeah.
And then you're in such severe pain, you realize what did I do that made it worse? And then you think back, you know what you did. So
right. We all do know. We may not be honest with ourselves at times, but we all do know, right? And it's not good. I try and discourage my patients from doing stuff like that, because aside from physically it hurts, emotionally it sends clients into a tailspin.
Yeah, it does. It did with me also. Now, do you also treat them like say after my hip replacement, I went for physical therapy. Now, is there like just a protocol for say hip replacement, or is it should be based on, I guess, the individual person?
Right. So there is, I mean, depending on the procedure too, did you have a lateral hip replacement or an anterior approach, right? Yeah. So the older fashioned lateral approach, there are some guidelines for hips where you can't sit with your hips flexed past 90 degrees. You can't cross your legs. The anterior approach, not so much, but the muscles that need to be strengthened after are the same muscles that need to be strengthened before. The surgeons here in Toronto are encouraging patients to get as strong as possible and try and prevent surgery. If they do need surgery, they still want them to be as strong as possible going into surgery. And then, of course, on the flip side, out of surgery, strengthening is important as well. So we have had some clients in our class after surgery.
So getting back to the osteoarthritis, how would somebody know, whether, of course, I mean, some people have, say, pain in the hip or pain in the knee. How do you know that it, other than going for an x-ray, that it's bone on bone, or is it just, some type of arthritis?
Okay. So good question. Now an x-ray is definitive. An x-ray will tell you if you've got arthritis. Now I want to be careful that people don't become victims of their imaging, right? Because someone can have on x-ray, a terrible x-ray, bone on bone, moderate to severe arthritis, but they may be functioning fine and not painful. So don't just rely on your image findings, rely on how you're functioning. Because I promise you, here in Toronto, people who have bone on bone but are not having any symptoms, the surgeons will let you go about your life. They will not do any surgery. It really comes down to how much pain are you having and how much dysfunction. I have a lady right now. She's very slight. She walks like a maniac. She walks like 2.5 hours. We only found out that she has moderate to severe osteoarthritis of her knee because she happened to fall and she tripped and bruised her knee. So they took an x-ray just to make sure nothing was broken. But that goes to show that you can have moderate to severe osteoarthritis and be walking 2.5 hours daily. I mean, she's really a fanatic. She's one of the patients I have to rein in, right? But not have any discomfort. So
Wow.
A lot depends on how strong you're keeping the muscles around the joint, how strong you're keeping the other muscles in the joints above and below, how strong you're in the core, and how strong everything works together in a coordinated fashion.
So basically what you're saying is that people should exercise and
all of us
stay in shape.
All of us, right? Myself included. I tell my patients all the time, we all need to find out where we can start, and then we get stronger from there. And I have some people who are quite deconditioned, but they can get stronger. They just start at a lower level. And I have some past athletes who are quite strong, but they can still get stronger. And that's what matters. It's the getting stronger from where you are that makes that difference. And I do my program 2 to 3 times a week on top of other things that I do.
That you do. Now, what if, I know you mentioned the osteoarthritis. What if they have the other one? The
rheumatoid?
Yeah.
Yeah. So with rheumatoid, I actually personally don't have much experience with rheumatoid arthritis. I, as a student, worked at our rheumatoid and arthritic hospital, but that is the extent of my experience with rheumatoid arthritis. So personally, I do have a webinar. If people see my ads on Facebook, they go to my webinar. I do make it very clear that it is not for people with rheumatoid arthritis.
Right.
If you've got osteoarthritis, if you've got a Baker's cyst, if you've got a meniscal tear, then I'm for you. But if you've got rheumatoid arthritis, if somebody ends up, even getting to speak to me, I will try and refer them on to a physical therapist who has that experience, because it is slightly different. There is a much more systemic inflammatory process going on.
Now, I know you mentioned Baker's cyst.
Baker's cyst.
Yeah.
Yes.
What is a Baker's cyst?
I know a lot of people get really frightened when they see that on the imaging report. I have a Baker's cyst. Nothing to get too alarmed about. It is a finding. Okay. We all have an extra fold in the back of our knee.
Oh, okay.
And a Baker's cyst occurs when that fold is filled with fluid. Okay.
Oh,
and
okay.
It's quite common in people with knee osteoarthritis. That's where you'll see it.
That's where you see.
So when they come to me and say, but I have a Baker's cyst, I don't have arthritis. Yeah, you do. You do, right? And some people may only have meniscal tears, but usually we know the history, they're going to end up with osteoarthritis. Same with anybody who's got any kind of cruciate ligament tear, especially the anterior cruciate ligament,
Okay.
or any history of, we know the history, they are going to end up with arthritic knees.
Okay. So then in that case, then they probably would need a knee replacement.
No, they need to get on the road long before that, right?
Oh,
They
okay.
need to get they need to get on the road. The whole goal is we're trying to prevent, because worldwide, right? Worldwide, the number of people that are going for hip and knee replacements is rising.
Mhm.
And just like we have learned how to prevent heart attacks and teach people prevention, we've also learned how to prevent varicose veins and teach people prevention for venous insufficiency. Same thing is happening in the world of osteoarthritis. We are trying to catch clients early enough on that road that we can get them on the right track and slow the progression so that they don't need that joint replacement.
A joint replacement.
Yeah.
Now, what if someone already has like the osteopenia?
Osteopenia?
Yeah.
Okay, so osteopenia and osteoporosis are two different things, are different from osteoarthritis.
Okay.
So osteopenia is a thinning of the bone, a demineralization of the bone, and osteoporosis is more severe, right? And osteoporosis puts you at risk for fracture, and there are many different causes. I mean, definitely postmenopausal woman, hormones play a part, but I do know a nutritionist, and he had osteoporosis at age 31 because he had irritable bowel syndrome and he was not absorbing the nutrients from his food. And so at age 31 male, he was fragile, and he has since overcome that and developed a program around that. So that is a whole different thing, from osteoarthritis. But there are programs out there and some very good programs for people with that.
Because yeah, it's I recently just found out for me that my calcium was very high in my blood. Going to the bones. And so after going to specialists, and I ended up at UCLA, and they found that one of the parathyroids has to be removed.
Okay.
And that's something I would never have thought that affects my bones.
Oh, the thyroid and parathyroids. I mean, our bodies are really amazing at how much little intricate stuff goes on to keep us functioning normally, right?
Yeah.
Yeah. Yeah.
So
yeah, the thyroids and parathyroids do a lot of work.
Yes, they do. And it's all, especially with the calcium. And yeah, so I actually have to have it taken out April 3rd, 14th. But I'm happy I found it now. And I'm saying to myself, wow, I wonder if that was the cause of maybe my hip.
It may have been.
Mm-hmm.
It may have been. Who knows? All right. But, that's a reasonable thought.
Yeah, and that did cross my mind.
Yeah.
So, I know you mentioned about, nutrition. So what are some, I guess, natural remedies that people can take other than like, Motrin or?
I wouldn't call Motrin natural.
Yeah. Oh, okay. Yeah. Well, I was on a lot of Motrin.
Okay. So don't quote me. I am not a naturopath. I am not a nutritionist. I'm just speaking as a lay person. But having worked with my own naturopath and knowing naturopaths and working side by side with them professionally, when it comes to osteoarthritis, there are a couple of supplements that are out there that have been shown to reduce whole body inflammation. So if we're looking at whole body inflammation, we can look at turmeric,
yes,
or curcumin, right? Or, for me, just have a good old fashioned curry, right? Have a Thai curry, have a West Indian curry, an East Indian curry, right? But those are two supplements. The other one that I learned about through one of my patients, through the naturopath I used to work with, Boswellia. Have you ever heard of that?
Oh, yes, I have. Yeah.
Yeah. That was new to me last year. Right. And so otherwise known as Indian frankincense. And the studies are showing some good benefit from Boswellia for people with hip and knee. I have a little bit of osteoarthritis in my foot, in my midfoot. and I was having a lot of stiffness, and my naturopath put me on omega-3 fish oils for general body inflammation. I found those were helpful. If we're looking at rebuilding of the cartilage, there is glucosamine and chondroitin, right? And I mean, years ago when that first came out, you know, a lot of the doctors were, we don't have enough research, but now there are studies that show, you know, I think it's still a little bit of a mixed bag, but some clients really like it and find it beneficial. Another new thing lately is a lot of people taking collagen or drinking bone broth, right? Yeah.
That's what I've been.
Are you taking collagen or are you drinking the bone broth?
I'm taking collagen.
Okay.
Yeah.
I've just bought some bone broth. I'm dabbling with the bone broth. We'll see.
It's a little
We'll
tough
see.
to swallow, but
yeah.
know.
Hey, I kind of have it like a consomme appetizer before lunch.
Yeah. Sometimes you just gotta chug it down. So chug
and suffer.
That's why I do some of my, you know, green drink. I mean, it tastes horrible, and no matter what I do to it. And I just say 1, 2, 3, we're down the hatch. Right. We're good.
So
yes, you have to do it. Yeah. But I thought about the bone broth, but I've tasted it and it's a tough one. So I figured maybe I'd mix it with something. I don't know. I
haven't opened it yet, but there's a Canadian company and they are advertising better flavor, easier to drink. So what they've done, for instance, in their chicken, they've put ginger and turmeric.
Oh, okay. So that's
right. In their beef, I think they've got, I don't even remember. I'd have to go look at it, but in their beef, they've got, you know, some other spices to kind of still give you the bone broth,
right,
but at least a little bit more palatable.
Now, right. I know when my daughter gets like, when she has time, she actually makes her own.
Yeah, if you have a crock pot, it's not so bad, right?
I know it takes her hours.
Right. And that's the difference. I mean, somebody asked me the other day, what's the difference between stock and bone broth? And I believe the difference is how long. I mean, I think a traditional stock, you're only cooking for 4 hours? Whereas I believe bone broth has to go down because they're trying to break down the tendons, the collagen, the bone, right? To get those essential things, right?
Takes a long
time.
But
a crock pot, I believe, I understand a crock pot does it well.
Yeah, I know it takes her hours or maybe even overnight. I mean, I know it's a long process.
Yep.
And then she gives me some and I really try my best. I was all right, what can I do here? You know, but I do take it though when she makes it. Because I don't want to waste it, you know, and I know it does me good. And she tells me, you need to drink it. You need to drink it. So I listen, but it's a tough one though, but I do it. So let me ask you, someone say, you know, that so basically you just do hip and knee, or do you also do shoulder?
Okay, so aside from this particular program that I'm talking about, I do have a virtual physical therapy practice. And I will, if somebody wants to see me virtually via Zoom, I will see people for any other, from the jaw to the big toe. As I mentioned, I have a lot of specialty in the jaw as well. I have a lot of experience with feet, a lot of experience with shoulders. Shoulders and knees are very common joints that we see all day long, 24/7 for physical therapy, all day long. So a lot of experience with shoulders and knees. So I do have a virtual practice aside from this special program for people with hip and knee. And let me just make something quite clear, because a lot of people, and even myself, prior to the pandemic, a friend was encouraging me to go virtually. And I'm like, but physical therapy is so hands-on, you know, how can I? And then the pandemic happened, and here in Toronto, everything was closed for 3 months. So we had to see our patients virtually. And I was a little nervous about it and stuff, but you'd be surprised at how much we can see. My clients are always saying, you can see that? And it's like, oh yeah, I can see that. And honestly, in the end, if I have one thing to give any patient, it's going to come down to exercise. I do not believe in dependent treatment. I don't believe in here's your machine to get you better. Here's your heat, here's your ice. Those are all nice, they help. But I believe in empowering the patient and giving them things that they can do for themselves to get themselves better. And for everything, even when I went to my own physiotherapist with my back giving me trouble 3 years ago, the very first thing she said to me was, well, you're going to have to get strong.
Oh,
that was the very first thing she said to me. It will never leave my ears. Right.
That's
And
powerful.
she's
powerful.
yeah, and she's one of our top in the country in Canada, and she teaches all of us and examines all of us, right? And that was the very first words out of her mouth. And even though she's excellent manually, the very first thing was, well, you're going to have to get strong.
And that's
right?
work. You need to work
Yep.
at it.
Yeah. And so now I realize that, yes, there are a lot of clients that I may want to see and get my hands on them, especially if I'm going to do a needling technique. Obviously, I can't do that by Zoom, but for many things, and especially for like this program, hip and knee, it's exercise. And what's good about the program is historically, and this again came out of the research in Denmark, we give patients our exercises, they go home and they do them. Some people are good for a couple of weeks and then they fall off the wagon, right? Some people are good for months, but then they're doing the same level of exercise 4 months down the line that they did day one, and they haven't progressed them, so they're not seeing the results they can see. And for all these reasons, this was developed into a program.
So now the program is getting back to the program again. It's 2 months long, and
yes,
like, what is it, an hour each day, or?
No, it's not an hour each day. It's 2 months long, and it's only twice a week. And again, research driven. Okay. Years ago, when I first started as a physio, we would give our clients exercises to do every day. Now, when it comes to mobility and stretching and flexibility, yes, we still give you every day. Maybe if it comes to basic core strengthening, I'll still give you every day. But when it comes to strengthening, right, and we're looking for really building muscle strength, once a week is not enough. Twice a week gives you maximum growth. 3 times a week gives you a little bit more growth, but it's not statistically significant. And so again, everything about this program is evidence-based, and that is why it is done twice a week.
Twice a week.
Yeah.
And
and our muscles, actually, we've also learned over the 35 years that I've been a physical therapist, our muscles are actually growing when we rest. They're not growing when we work them, they're growing when they recover.
Interesting. So can once they have the program, can they, like, I guess, do it again, or they just need to do it the one time, or?
Oh, very good question. Right. And when I took the course as an instructor, all of us asked, said, well, what happens now? I mean, because we know that strengthening has to continue. Right. And so what they did was, the organization that trained us then decided to collaborate with another organization that trains fitness instructors and personal trainers, and they put in an extra chapter on osteoarthritis. So my husband, who is a personal trainer and coach, he teaches what we call our graduate classes. Okay. And so once people finish with the guidance of a physical therapist, they can move into a maintenance program. And I'm always overseeing, even though Andre's treating those graduate classes, if somebody, say, went and did something and tweaked their knee, and Andre says, Suzie, just come back in and take a look at this person and see if we need to modify, whatever. So there's always both of us overseeing. So the initial program is taught by me as a physical therapist, and then the ongoing program by Andre as a personal trainer. But I'm always there in the background if there is a problem or need to consult.
Oh, okay. So it's ongoing. So how did you guys meet? I'm just curious now.
On a hike.
On a hike?
Yes. Have you ever heard of hash house harriers?
No, I don't think so.
Okay, so let me tell you what hash house harriers are about. So this is a worldwide movement. You should look it up in California, because I bet there's some hashes there. But it started in Malaysia. It was a group of expats who wanted to get to know the country they were working in. And they would meet at regular intervals, whether it was once a week or once every 2 weeks. And somebody would be responsible for setting an impromptu hike. And so they use in Jamaica. So I met Andre in Jamaica. They use clumps of shredded paper. If you see a clump by the side of the road, you're on the trail. Keep going, you see another clump, you're still on the trail, you see another clump. If you come to a circle, right, you have a choice to make. If you go right and then you come to an X, you took the wrong choice, go back to the circle, go the other way. And so it's an impromptu hike. And then after it, it's socialized over, you know, either just brunch or whatever. And so that's how we met. We met on a hike.
Interesting. And he was he a physical was he a trainer at
No,
that?
no, Andre wasn't a personal trainer at that time. Andre actually is a car freak, car nut. He was a navigator for rally car racing for years. And he worked in car sales and tire sales and stuff. But he was quite heavy and got very fit, right? And he started walking, and then he started to run, and then he started to mountain bike and hike, and he got very fit. And when I first met him, he was cycling like hills, up and down and up and down and up and down. And I encouraged him to become a spin instructor. And then I was working with another personal trainer with my clients. This was when I was living back in Jamaica. And but I wasn't getting any feedback. I would send my clients to this personal trainer, but never get any feedback on how they're doing. And finally, I just said to Andre, okay, you don't have his experience, but you live in the same house, so I can see how my patients are doing and make sure they're doing okay. And so he did the personal training certification, and that's how he started. And so that's what, about 14, 15 years now.
Wow.
And so we have seen many clients together in both countries, Jamaica and Canada, over the years. And now with Zoom, we're all over.
Wow, what a beautiful story. See, people go hiking, you don't know who you're going to meet.
Yes.
It's better than the online dating. So,
yeah.
Oh, interesting. So he's been doing this for a long time. I mean, you've been doing it for 35 years. He's been doing it for what, 14 years?
Almost 15. I think 15. It's
Wow.
about, it's not quite 15, 13, 14, around there. Yeah.
It's a long time. So, do you work at a medical facility or?
Okay. So, in the afternoons, I do work out of a physical therapy clinic. Okay. And Andre is now, because again, in Toronto, we have been one of the most locked down places on this earth.
I know.
So the gyms in particular were locked down for a very long time. So he teaches out of one of our universities. He teaches classes there. And they have just called him back to work. When Andre is not doing personal training or teaching fitness, he also works for a company that organizes triathlons and road races.
Oh, okay.
Right. And so the first year of the pandemic, there were no events. And then last year they managed to salvage some triathlons and some road races. And this year they're looking forward to quite a full season, because, you know, people are tired. They want things to do.
We are. I mean, here in California, it's been a little crazy too, but they actually just lifted the mask mandate, but everybody's still wearing it. So but at least we're able to go back to work. I mean, I was out of work for about a year.
Right. We were only closed in the clinic for 3 months. And we've been back in clinic with masks. Clients wear masks, we wear masks.
Right.
And that's been fine. That's been fine. But no, the gyms here took a big hit. Restaurants took a big hit. So we're looking forward. Well, we're looking forward to two things: the -7 to -17 going away. Right.
I can imagine.
Right. Because the warmer the weather, the better. And to getting back outside. I mean, we're going to go snowshoeing tomorrow. We will bundle up and get out and go. Right. But where things are opening up again, and Andre's looking forward to getting back to teaching classes.
So now, does he also do the online with you, or is that part of your program?
Well, no, not at the beginning.
Okay.
When we first started, he would be in the classes with me. I would be teaching them, because the program is to be taught by a physical therapist. And then from there, and then clients would get to know him. And then when we had enough people who had graduated from the basic program, he would take them on into the
Oh, that's
graduate
right.
classes.
Okay.
And so now he's actually got more people in the graduate classes because we've been doing this for a year and a half. So he's got quite a few more people in the graduate classes because the main program is only 2 months, but the graduate classes can go on forever. Right.
So when someone finishes your program, so then they go to see him then?
Yes. Yes. And so think of it almost as like a medical exercise gym.
That, you know what? That's a godsend.
Yeah.
Because then they truly heal.
Yeah. And it's helpful. And I think a lot of clients like the security of, you know, if they go to a fitness class, they like the security of knowing that they're going to be guided the right way so as not to get injured. Right.
Exactly.
And again, sometimes, like I said, we have to treat personalities because there are some clients that we really do have to hold the reins on because they're doing too much. They're doing too much, right? So I don't like to stop people from doing what they enjoy, but at the same time, they need to learn parameters.
Yeah, not overdo it. Yeah, because we overdo a lot of things.
Yeah, and listening to our bodies, right?
Yes, that's the biggest thing. Trust me.
Yeah.
I know for a fact. I mean, as an energy healer, I listen to my body.
Right.
And that's how I found my situation. By just listening to me. So, and it's important, you know, if we feel something, we need to check it out to see what it is. Yeah. And not be afraid, because the more you're fearful, it could get worse.
Yes. And I think, and I don't think that ignoring a problem makes it go away either. So we do need to face them.
Yeah. And facing sometimes is challenging, but at least you get done over and done with. So, you know, so now again, what is the name of the program, and where can they find you, and, you know, your website and
excuse me. Okay. So I'm going to give you a couple things. So the name of the program is the Joint Pain Relief Program.
Okay.
Right. I advertise on Facebook, so they might see ads on Facebook. I'm about to advertise again to the States. Okay. I am also, my virtual practice is at www.SuzieForemanPhysiotherapy.com. So in Canada, we're called physiotherapists, in the States, physical therapists. So www.SuzieForemanPhysiotherapy.com. And then there are advertisements on Facebook. If someone wants to book a free consultation call with me, just to discuss their hip or knee or any problem, if they want to book a free consultation call with me, they can book that call at in the States, USA.getjointpainrelief.com. So that's USA, not www, USA.getjointpainrelief.com. Okay. So let me, was that clear?
Yeah. Well,
I kind of gave you a bunch.
Yeah, do it again.
Okay.
Yeah, and I'm going to also put it in all the notes. So I need all that information so that everyone can click on it.
Okay. So, okay. So my website, www.SuzieForemanPhysiotherapy.com. If they want to book a free consultation call with me, people in the States. Okay. Is it only people in the States that watch your program?
No, actually, it's now international. I'm in New Zealand. A lot of Canadians have been watching my program. We're in Spain. We're in United Kingdom. When I looked, I saw it's going international now.
Okay, excellent.
Majority is United States, but it's international.
So the best place to book that call would be to USA.getjointpainrelief.com. Okay. And Facebook, you'll see ads. You'll see ads on Facebook. Not people in England or Australia, New Zealand, not yet. That's coming. All right. But certainly in Canada and the States, they will see Facebook ads.
Wow. So your program is really helpful for those that really need help.
Yeah, I am looking to really, I like I like this medium. All right. I really like this medium. I like that we can hone down and really specialize in one area. And with 35 years of experience, I feel I've seen a lot of people with hip and knee. And, you know, if I look back on my career, I've helped many people. And I would look back and tell you that 80% or more of my clients have been successful, regardless of if it's hip, knee, or the jaw, or the foot, or whatever.
Or whatever.
Yep.
You.
And I think that's because I've also had the good fortune of working with great mentors. I've worked with probably about 3 or 4 really good physiotherapists that I've learned a tremendous amount from, and they have made me that much better.
Well, yeah, we always need to learn.
Yep.
So we can grow and help others. I mean,
yep.
You know, when we're of service and helping others, it's a beautiful thing.
Yep. And I love it. I love it when my clients succeed. You know, it's so funny. It's so funny when a client comes in and says, well, I'm better. I'm like, well, isn't that what you want?
Yes.
And I mean, and I've had clients come into the clinic and I'm like, well, how are you? And they're like, I'm better. And I'm like, yeah, but that's why you're here.
But then they probably still want to come because they're better. Yeah. But they don't want to, you know, all of a sudden not go. Right. I have clients like that. They tell me, wow, they're great. And I tell them, well, good. See, now there you go. That's why, you know, you came to see me. And they tell me, yeah, but I still need to see you. But
right.
But we have to figure out why then.
Right.
So yeah, it's a wonderful feeling knowing that, you know, we have the ability to help others heal.
Yeah, I mean, lots of patients over the years have asked me, you know, so do you like your profession? Like, yeah, I've been very lucky. I've been very lucky. Like I said, it's a small segment of physical therapy that is really suited to me. But yeah, I'm really lucky.
Oh, thank you so much. And I'm lucky to have found you, believe me.
Right. Well, I was very, very pleased when you approached me. I'm like, oh, yes, I will be on your show.
Well, thank you.
Right?
I know, because it's all about, of course, it's called the Spiritual Warrior Coach, but it's all about getting into your power, you know, and thinking positive, like you said.
Right.
It's so important because the mind can help us or not help us.
Definitely.
So
definitely be careful what you think because your mind is listening.
Yeah, boy, it does. Yes, it does.
Right?
Yes, it does. So yeah, we need to think positive and know that whatever the situation is, you know, it that too shall pass.
Yes.
And not to become a victim of whatever it may be.
The universe is working in your favor.
That's what I always tell everyone.
Yep. Even listen. Silver linings. COVID, I didn't like what it did to, you know, to certain things, but the silver lining has been, it has given me this huge opportunity for my profession and to evolve into a different type of service.
Yeah. I mean, you know, it's and a lot of us, you know, during COVID, you're stressed. And then now all of a sudden we're home and we say, all right, now what am I going to do? But it was all about being home finally.
Right.
And seeing the importance of being together, you know, with your family and having that time to make a dinner, you know, or whatever it may have been. So yeah, it was a blessing in disguise.
Yep.
I feel.
Yep.
But Suzie, thank you so much for today.
Barbara, thank you. I've really enjoyed it. And I mean, once we talked the other day and stuff, I'm like, oh, I really like this lady. I love your warmth.
Thank you.
Right. And I'm not sure when I'm going to get back to LA. I used to have a very good friend living in LA, but then they moved to Colorado. So I'm not sure if and when I'll ever get back to LA, but you never know.
Just I'll send you my cell and you have my email. So please, you know, we need to get together. Do you ever get
to Toronto?
No, I've never been. No.
Oh, it's a nice city. Not now. Right? Between May and the end of October, that is my favorite time in Toronto, and it's a nice city,
especially when it gets a little warmer. Yeah.
Yep.
I mean, I'm from back east, from Brooklyn, so I know the cold.
Right. Oh yeah.
Not happy about it though.
Yeah. If you're from Brooklyn, you'll know. Yeah, I would say May to the end of October, and September is particularly nice. Early September.
Oh.
Yeah. Yeah.
Okay.
So,
Well, we'll stay in touch. So that's for sure.
okay.
Well,
Excellent.
again, thank you so much, Suzie. And thank you for my listeners for listening. And I hope that you heard, excuse me, what you needed to hear. And please visit me at motivateyourlife.net. And please subscribe to this YouTube channel, The Spiritual Warrior Coach. I'm not just on YouTube. I'm also on Spotify and Apple and iHeartRadio and everywhere. So, and please like and subscribe. And maybe for those of you that are interested in learning energy healing, check out my book on Amazon, Gentle Energy Touch, The Beginner's Guide to Hands-On Healing. So thank you again for listening. Have a beautiful week filled with love and with light. Love, Barbara.